Allergic rhinitis is extremely common. It's one of the most frequent conditions we see in our practice.
Dr. Atanacio Cob is an ear, nose, and throat specialist. He has seen countless patients who have consulted with him on how to manage their allergies.
Allergic rhinitis is the response of our, in the case of the nose, of the mucous membranes, an exaggerated response to something that irritates it. And consequently, it will give us inflammation, sneezing, runny nose, stuffy nose. Seasonal allergies are known are the ones that occur during certain times of the year. For example, now when it's dusty, windy, lot of flowers blooming, plants, we have the person who typically suffers allergies in this time of the year. And you have the perennial allergies, those people who suffer allergies throughout their whole life, throughout the whole year.
But why are some people spared of the miserable effects of seasonal and perennial allergies? It's all about genetics and environment.
Fiancés who marry people who are allergic will have about 25%, if one parent is allergic, about 25% of their children will suffer with this condition. If the two parents have allergies, then 50 to 100% of their children will have allergy problems as well. They say that there's about close to 1 million days lost worldwide in school days for children. So maybe for somebody who doesn't have any allergy problems, non-issue like you say, but those people who suffer it have terrible problems with sleeping, congested, they have poor performance at school, at work, daytime drowsiness, and of course, very costly.
Allergies are triggered by what would normally be considered harmless substances in our environment. The key to coping with allergies is to learn exactly what those substances or triggers are.
Here, the perennial allergies are things like simple things, dust mites that live in our mattress, in our pillows, cockroaches, mice, and pets. Talking about the dust mite, people used to say, well, it is the dust. It's not really the dust. We have found out that if you apply pure dust in the nose, the person will not trigger his allergy reactions. But it's mostly the mites, a very tiny little insect. It's a family to the spider. He predominantly comes out in the night and feeds on this shedding of our skin. And so the feces of these dust mites have a very powerful allergenic effect on the nose. And so the child will go to bed, and they will wake up in the morning with sneezing and so on.
Other common triggers include pollen from plants and flowers. Animal dander, the flakes of your pet's skin, is another common trigger, as well as their saliva and urine. Mold, which is very common in humid countries like Belize, is another recurrent trigger. The problem with allergies is not just the miserable effects. Allergies can also worsen asthma and other respiratory illnesses.
The allergy conditions predispose to other things, for example, sinus conditions, throat congestions, voice problems, air problems, eye allergies. So it spreads up to all the areas in the mucous membranes of the head and the neck area.
Cleaning your environment to remove known triggers, washing bedding once a week with hot water, removing plants from the vicinity, and clearing out areas or items prone to mold are some ways of preventing your allergies. Some of the other traditional remedies can work as well.
Old time people used to take out their mattress in the sun and keep it in the sun for a day or so, and that Maybe they didn't have any scientific background to do it, but it decreases the amount of termites, kills them. They cannot survive in high temperature. Vicks is one of the things. It cools down the nose. It gives a temporary relief. People say, boy, I go in this East, I go in the sea and put my child in there. And that has a soothing effect because of the salt water. It decongests and it actually dehydrates the mucous membranes, because remember, the allergies makes the membranes very swollen, very boggy looking, full with water, and that's why you can't breathe. When you dump them in the sea and you go put your head down, and the salty water actually dehydrates the membrane, so it improves it. It improves the sinus conditions too.
As for the doctor's advice, his treatment is geared towards prevention and control. The less the doctors visit, the better.
I would start first with education. Because there's no way I can cure this patient's problem. But if I can modify his lifestyle, his attitude, the way he carries on, do some minor changes at home, teach them about medications, when to take medications, and so that will help my patient on the longer run, and he doesn't have to come and visit me every time he has a flare-up. The way I treat allergies first is to prevention, change some things at home, take antihistamines on a needed basis, and I concentrate more on the sprays because I know they will give more long-term relief.